Hello Recitavers, welcome back to the channel. Today's video really is to the people of Great Britain. For those who don't know me, my name is Bertha and I'm a registered nurse. Before I qualified to be a registered nurse in 2007, I worked in a nursing home. I also worked in a residential home. I worked as a support worker, caring for people with learning disabilities. I've done all kinds of jobs, some of which I've spoken about in some of my videos. So that is my background. In today's video, I want to talk about the role of migrants in UK's healthcare. What prompted this video, or what inspired this video, is an article that I came across in The Guardian. The article was written by a man called John Harris. And when I read that article, I felt a little bit emotional because what John Harris wrote in that article really captured how I feel about the role, the vital role of migrants in healthcare. Because I feel that sometimes when we go on about immigration, when we complain about the level of migration in the UK, I feel that we don't really stop and think about the situation on the ground, the reality on the ground. The reality on the ground is that migrants are the backbone of UK's healthcare system. Because if we look at the numbers, you will find out that 1 in 6 NHS workers is a migrant, and the numbers in social care are even higher. And by the way, I'm going to react to Mr. Harris's letter or article in The Guardian in a minute, but I just want to show you just how much the UK relies on migrant workers. And if we look at the nursing homes, residential homes, and other social care sectors, you will find that a significant proportion of the staff there are migrants. Migrant workers in this country do jobs that many people avoid. Mostly natives of this country avoid certain jobs like care jobs, working in care homes, nursing homes, working with people, who are dependent on other people to help them. People tend to avoid these jobs because, first of all, the pay isn't that great, and because of the long hours, and also the physical and emotional demands of the job. These are challenging roles, and it takes a certain kind of person to be able to do these jobs. I mean, I'm a nurse, so I know what I'm talking about, and I've also worked in nursing homes. So trust me when I say these roles are demanding. I want to emphasize that I'm not saying that we don't have natives working these jobs, because we have quite a number of natives who do these jobs, who are committed and who do a marvelous job. We have that. But when we look at the numbers, the figures in proportion to UK's population, you will find that a lot of migrants are the ones that are actually doing these jobs. Because from my experience, when I used to work in a nursing home and when I used to work in other areas as well, as a care worker, as a support worker, what I discovered was that during weekends and holidays, most of the staff on duty were mostly migrants. This is what I discovered, because I remember one Sunday when I was going to work, I was using a train that morning. I went on the train, and as I was walking, from carriage to carriage, looking for the perfect seat, I noticed that most of the people on that train were immigrants. There were people who looked like me, and I was like, okay, what is going on here? How come it is just us on this train? Are you trying to tell me that we are the only ones who work on Sundays? And as weeks went by, as months went by, I noticed that this is actually the situation on the ground. So anyway, going back to Mr. Harris's article, first of all, I just want to thank Mr. Harris for his heartfelt, I call it a letter to migrants. I want to thank him, and I want to appreciate him for outlining his experience, because he talked about his personal account of his 89-year-old father who was hospitalized in one of the NHS hospitals. And like I said, I was touched by his account. In that article, he talked about what he saw, the level of care that his father received from migrant doctors and nurses, the level of diligence. And in that article as well, Mr. Harris criticized the political leaders for promoting policies that undermine the contributions of immigrants. Because, like I said, a significant portion of these essential workers come from other countries like the Philippines, from Africa. I mean, we have a lot of Zimbabwean nurses because I come from Zimbabwe myself, Indian workers and all that. And in the article, Mr. Harris is emphasizing the moral obligation to appreciate the efforts of migrants and warns against the resentment that dependency can breed. And also, after reading this article by Mr. Harris, I came across another article, and it was a follow-up article where people were responding to his initial article. And what people wrote in that article really captures what I know about the United Kingdom. The United Kingdom that I moved to 25 years ago. The heading of that article says, "Migrant health and care workers deserve better than this." And people were also highlighting their experiences and making a case for migrants. They were really like going for it. What I read in those responses is what I know about the people of Great Britain. And as I said in some of my videos, especially the most recent ones, I say that when I came, things were different. And over the years, I have seen the shift in the sentiments, in the attitude towards migrants. And it is heartbreaking to see. And in a way, I know, I understand where that is coming from, because, we're talking about the level of migration to the UK, how resources are no longer enough and so on. But I blame our leaders for that, for letting things get out of hand. But unfortunately, the migrants who are already here, working, doing a good job, providing the care and the services that the UK needs, are suffering because of that. Because let us not forget that there are repercussions to that. There are broader implications. One of the implications is the fact that we now have a lot of resentment floating around, resentment coming from migrants, and also resentment coming from the natives of this country. Because on the one hand, migrants are saying to themselves, why am I being punished now that I'm here working, providing service that is needed? Why is my life becoming so hard? Why am I not being appreciated? On the other hand, the natives of this country are becoming resentful because of what they hear in the news, because the media is painting a picture to say that migrants in this country are just here to take. They are not giving anything. So because of that, they are also becoming resentful, because unless you get a chance to see what is happening on the ground or to interact with migrants the way Mr. Harris has, and those readers who responded have, then you won't fully understand the situation. Because in all fairness, immigrants do a good job in this country. And another thing as well that I want to talk about is the fact that when people complain about the level of immigration or migrants in this country, we seem to forget the vulnerable among us, those people who need migrant workers, who need the care that they provide, our elderly and other dependent groups. We seem to forget these people, because these groups of people that I've mentioned need the care. And if we are to say, okay, today we are taking all migrant workers out of the UK, let us click our finger and they vanish, what is going to happen? What do you think is going to happen to these vulnerable groups? How is the UK going to cope? Because the reality, like I said, the reality is that migrant workers are the backbone of UK's healthcare system. We cannot deny this fact, because sometimes when people talk about migrants or migrant workers, in their minds, they are picturing this person who's just coming here, to claim benefits, who's just coming here to abuse the UK. They're not considering the fact that among these migrant workers are doctors, nurses, midwives, people or workers who are in these critical roles that the UK cannot do without. They are not considering that, or at least it is coming across that way. Mind you, we have staff shortages as well, especially in the NHS and other areas as well. We have staff shortages, and this is the reality. Again, I go back to talking about the vulnerable, people who need the care. What is going to happen to these people? And another thing as well that I have noticed being a nurse, what I've noticed is that people we've actually had to be cared for, people who have been in the hospital, we have needed care, actually appreciate what migrant workers do, because they've witnessed it for themselves. So they know just how hardworking, how diligent these immigrant workers are. And the irony as well is that the people who tend to complain a lot, who tend to use strong language when they talk about immigrants or migrant workers, the irony is that these are the people we've got loved ones being cared for by migrant workers. That is the irony. Another thing as well that upsets me sometimes is the fact that the UK depends heavily on migrant workers, but at the same time, it pushes for policies that make their lives harder. I mean, make it make sense. Are you saying that all you want is what that migrant worker does for you, but you don't care about their quality of life, you don't care about their mental health, you don't care, about their well-being. All you want is their services. Don't get me wrong. I appreciate that there's a problem when it comes to migration and, the levels are too high and all that. I appreciate that. I get it. And like I said in some of my videos, that is up to our leaders to fix that problem by coming up with policies that aim to fix that problem without punishing the people who are here legally. Because people with visas who are working in the healthcare sector, who are working to help our elderly, disabled people, the vulnerable groups who need this care, they haven't done anything wrong. They were given visas to come to the UK. Instead of demonizing them, why don't we appreciate them? Because they are here now. It is done. They are here, they are working. What we need are real solutions without punishing migrants who are here doing a good job. And I'll end by saying this. Next time you hear someone complaining about migrants, I want you to ask them this. Who is caring for your loved ones in the hospitals, in care homes right now? Who is wiping their bottoms? Who is feeding them? Who is singing a song to them? Who is there sitting beside them, listening to them? Who is there caring for them, reassuring them? Who is doing that job right now, right this minute? What will happen if those migrant workers were to just vanish from the UK all at the same time? Because that is what people want, right? So what is going to happen if they were to leave right now? Who is going to care for the vulnerable, for the people who are sick? I want to encourage us to think beyond politics and consider the impact that migrants have in healthcare.